You're listening to the Quint podcast.
Mumbai, which is a coronavirus hotspot with over 51,000 confirmed cases, is struggling to provide beds for its patients. If the good news is that the city's case growth dipped and now stands at 2.93%, which suggests that the worst affected metropolis in India may just be getting a grip on slowing down the spread of the infection, the bad news is the BMC data that indicates that almost 99% of the ICU beds in Mumbai are occupied. While the opposition parties have raised an alarm about the severe shortage of beds in Mumbai, the state government has alleged that the opposition is politicizing the pandemic. But there's no denying that there are in fact a lot of complaints coming from citizens about not finding a hospital bed for patients, even for coronavirus positive doctors for that matter. With a surge of cases, a shortage of medical staff, packed wards, why is Mumbai's healthcare infrastructure failing so badly at this moment of need? In this two-part podcast, we dive into a city-wise case study of the two most affected cities in this pandemic, Delhi and Mumbai. In the first part, we analyze the hospital bed crisis in Delhi. If you haven't listened to that episode, please do check it out in the show notes. And in the second part, we're looking at the situation in Mumbai. You're tuned in to The Big Story, the podcast where we dissect the headline-making news for you. And I'm your host, Shorbori. A few weeks back, around 7th May, an appalling video from Mumbai's Sion Hospital went viral. The video showed coronavirus patients lying next to dead bodies wrapped in plastic bags. That video was allegedly shot inside a COVID-19 ward in the hospital. Soon after, a similar video emerged, this time from Chem Hospital. If these videos were not hint enough of how much pressure the hospitals are working under with the mounting cases in the city, another video surfaced online on 16th May, this time with a direct message from the resident staff of Sion Hospital. In that video, several doctors, interns and staff members were heard saying how the hospital is working under quote-unquote dramatic conditions with a dearth of medical equipments since the nearby Chem and Naya hospitals were packed and a lot of patients were being diverted to Sion Hospital.
Due to the conversion of Nair, Rajewadi and HBT into dedicated COVID centers,
a majority chunk of these cases have been diverted to Sion Hospital,
resulting in a dramatic addition to our already existing patient load.
Amidst catering round the clock to this huge population of sick and needy,
we, the doctors at Sion, have been facing a crisis.
To begin with, a shortage of adequate number of PPE, due to which we serve, putting our lives at stake each day.
There are times when one of our residents tests positive,
but we continue to serve courageously and united in spirit,
well knowing that we could be the next in line.
When most have the comfort of their homes in these difficult times,
we stay back at the hospital just to keep our families and society safe.
Young interns are working at a high risk at COVID positive centers with a minimum stipend of 6,000 rupees a month.
And despite all this, all you care about is one video? That was around mid-May, when Mumbai had less than half the cases than it has right now. But the demand for treatments and tests have only shot up since, as Mumbai went on to record more than 50,000 cases. Even as it managed to slow down the case growth in all wards, with the exception of P North ward in Malad, and also report more recoveries, the healthcare crisis has now spilled over to an acute hospital bed shortage. A tweet by a resident of Mumbai, Nithya Ganesh Selvaraj, describes his experience in trying to get his father admitted. His father wasn't a confirmed case of coronavirus and was awaiting his blood test when they were looking to admitting him for a typhoid treatment. And yet, the Twitter user says that he couldn't get his father admitted to Hinduja, Leelavati, Nanavati, Raheja and Reliance hospitals. And I'm just going to read out one of his tweets for you. Quote, "None of them got him admitted, stating that they are overflowing with COVID patients. Finally, I took him to Sion Hospital where he was tested and remarked as death on arrival. They gave me the death note as natural death. My father's last rites were performed and the very next day the result came positive. We lost the COVID fight." End quote. I also got in touch with Dr. Ravindra Maske from Sangharsh Nagar, Chandivali, who says that it's not just hospital beds that patients are having to queue up for. Even tests are taking a long time. Moreover, the whole process of getting admitted has now become daunting and arbitrary. Listen to his experience.
मैडम एक्चुअली क्या होता है, जब भी पेशेंट हम लोगों के पास भी आता है, एक एक दो दिन हम लोग भी बुखार के पेशेंट को यानी फीवर के पेशेंट को हम लोग ट्रीटमेंट करते हैं, तो वो टाइम अगर हम लोग पेशेंट को बोलते हैं कि आपको कोविड वगैरह चेक करना है, तो बीएमसी में जब भी हॉस्पिटल में जाना पड़ता है तो बीएमसी में लाइन लगाओ, एक एक दो दिन ये करो, और अगर कोविड पॉजिटिव भी आता है मैडम, और हम लोग
What happens is, when patients come to us with fever, even as we prescribe medicines, we advise them to try to get themselves tested for COVID-19. And there's usually a long line at BMC run hospitals for tests. And even for positive cases, if we contact the hospitals, they mostly have no vacant beds. Sometimes they admit the patients only after 1 or 2 days. I had a patient who was coronavirus positive. For 4 days he had to run around at Rajawadi hospital with a fever, and then he himself bore the expenses of his test and got it done from Holy Spirit Hospital. The test result came after 2 days, and I called up the hospital myself to get him admitted, but there were no ambulances. Then he had to take a private vehicle to Seven Hills Hospital, and there he was told that since he didn't come in an ambulance, he can't be admitted. Then this patient had to go to Holy Spirit and take an ambulance back to Seven Hills, and only then he managed to get an admission.
पेशेंट बेचारा वापिस प्राइवेट उनकी खुद के व्हीकल में वापिस होली स्पिरिट गया, होली स्पिरिट से फिर एम्बुलेंस करके सेवन हिल के पास गया, तो फिर सेवन हिल वालों ने उधर से शिफ्ट किया उनको पवई हॉस्पिटल में। वो तब तक के लिए मुझे एमओ से बात करना पड़ा, येलवाड़ के आयुक्त से बात करना पड़ा, तब उनको वो मोमेंट मिली।
But why this crunch? How much is Mumbai prepared in terms of COVID care facilities? Let's look at some data. According to the latest government bulletin, of the total bed capacity of 9,092 beds in dedicated units, 8,570 beds are occupied. Almost 99% of the 1,097 ICU beds are also occupied, and 378 out of the 442 ventilators are currently in use. And as of 7th June, there were 137 beds available in private hospitals and 512 in public hospitals for moderately or severely ill patients. And as the opposition has been crying foul over the situation, on 7th June, Mumbai Mayor Kishori Pednekar clearly told the media that the beds can't be given to every patient and only emergency cases should be given beds. Now, given that the cases were already high in Mumbai from the initial period of the lockdown, didn't the government prepare to face this surge? Vaishali Sood, the editor of Quint, which is the Quint's health vertical, analyzes the healthcare crisis in the city.
It's not like an effort has not been made to scale up. There's clearly been an effort over a period of time to add more beds, to add more, COVID care centers, COVID healthcare centers. Now, when it comes to ICU beds, which is what is needed for critical patients, the numbers have certainly gone up. About a month, 2 months ago, there were 371 beds, ICU beds. Now they have 1,100 ICU beds. Over the next 10 days, I believe there'll be 500 more. But the current alarming situation is summed up by the BMC chief, who in an interview with one of the news channels said that currently they have only 30 ICU beds vacant. And we have to remember that once a bed is occupied, it's not occupied for a day. It's occupied for next 10 days, 14 days. So the beds don't get available overnight. They have to be added. And that's a situation Mumbai finds itself in. It may have enough COVID care beds or oxygen supported beds, but it certainly doesn't have enough ICUs currently. Now, Mumbai is currently today in a place where perhaps New York and other big cities of the world were nearly a month ago. And Delhi currently is in a position that Mumbai was nearly a month ago. So while they keep adding more and more beds, they have to also think a little more proactively, perhaps move some of the ventilators in areas where there's been very, very little impact of COVID or no impact of COVID to the city to help them support the patients who are coming in. They need to streamline information, and they need to streamline services so that, if someone falls sick, they know where to go. They need to procure more ventilators, and they need to support their healthcare workers at this current time. We've heard from residents who are saying they're completely and utterly overwhelmed. There's a shortage of staff in every hospital. There's a shortage of nursing staff, there's a shortage of ward boys, there's a shortage of doctors, and the pressure is building up on the healthcare workers day by day.
Vaishali also points out that if there's a dire shortage right now, with monsoons coming, the situation could turn for the worse.
Mumbai has done a lot more testing than any other city in the country, but they need to expand more on their testing. With monsoons coming up in Mumbai very, very shortly, that's another big worry for the city. Already I think the BMC has said that we will need to start looking at people with fever symptoms, not just for COVID, but also for dengue, chikungunya, and the other host of diseases that come with monsoons. So that's something that's the bigger worry for Mumbai currently, because, if already COVID beds are completely occupied, what will happen a month down the line when monsoon peaks?
BMC data now shows that the city is depending on jumbo facilities. These are basically makeshift hospitals that were only beginning to be used until Cyclone Nisarga hit, and the 242 patients who were initially admitted had to be shifted out. That's what Mumbai Mirror reported. The Jumbo Isolation Centre in Bandra Kurla Complex, or BKC, has 504 oxygenated beds, and according to the Indian Express, currently the facilities at Nesco, NSCI Dome, Racecourse and BKC are running full. But by June 14, more intensive care beds will be added in Nesco, Mulund, BKC, the Hisar and also in Racecourse jumbo facilities. But will this ease the burden on hospitals? That'll be left to see. If you like listening to this episode, please subscribe to the Big Story playlist for episodic updates. We're live on Apple, Google Podcast, Spotify, JioSaavn, and most of the other popular podcast streaming platforms. For other podcasts, please log on to the Quint website and check out the podcast section. For any feedback, shoot an email to podcasts@thequint.com.
Thanks for listening. Log on to the Quint's website and check out our other podcasts.